Hi, my name is Professor Andrea Rockall. I work at Imperial College London in the UK, and I'm a Chair of Radiology at Imperial and Chair of the ESR Board of Directors. And today I've been asked to talk to you about sustainability in radiology, which is my passion topic above and beyond my clinical interests.
Why is it your passion topic?
When I was young, I was always interested in the environment, recycling and energy saving, switching off the lights at home and what have you. And I've just carried that through in my professional career, but more recently, with the real evidence of change, with the climate change upon us, it's become much more urgent, and I've now decided to make quite a focus on sustainability, and I've started actually doing a research in the area because I think without having research and baseline measurements, knowing where the big impacts are, we don't really know, and we can't be really convincing about how we can mitigate what we're doing in healthcare.
You made the point that radiology has a lot of skin in the game in terms of carbon footprint. Can you just give a sense of that and also then talk about what responsibility therefore it has to, and opportunity to address it?
Yes, of course. I mean, healthcare carbon footprint varies country to country. It's very high, for example, in the United States. It's very low, for example, in Africa. So, but when we look at the proportion of diagnostics within the healthcare carbon footprint, diagnostics carries quite a heavy load. And if we look at where it sits in terms of proportion, the buildings are probably the biggest proportion of carbon footprint, but then the pharmaceutical and medicinal products come second and third, but then diagnostics come fourth in the big impact area. And of course, we have large machinery, we have helium, we have a lot of computing going on with the PACS workstations, and we have massive data storage with all of the heavy data that we generate with all of the medical imaging. On top of that, we have the contrast agents which are going into the watercourse, into the environment, both the iodine and the gadolinium. Plus, again, we have a large amount of waste with single-use plastics from all of the tubing that we use for contrast agents and for interventional radiology. So we hit a lot of topic areas here for waste, for energy usage, water contamination and plastic waste.
You said it's difficult. There are a bunch of areas that cause much of that, which are buildings, the design of buildings, supply chains, etc., that an individual radiologist or team can't really address. But you said there is a lot of scope for individual or team local action, yeah?
Yeah, what I think is really important for our radiology community is to understand what are the things that we can impact ourselves in our daily practice that will actually make quite a big difference if we scale it up by all doing the same things. So there's things that don't cost us any money, and actually, conversely, they save us a lot of money. Switching off is the easiest one, except that that requires us to remember to do so, and also to know that it's safe to do so. For example, some machinery may not be safe to switch off, but we need to know which machinery can we switch off, and if so, we need to have a system whereby machinery is being switched off regularly when it's not in use, either at the weekends, in the evenings. That also includes heating and cooling, for example. So switching off the PACS workstation actually saves a huge amount of energy. And where I work, we instituted an automated switch-off software across all the PCs in the whole institution, and we saved over each year we save about £500,000 in electricity compared to not using the software. And we know that because the software measures the energy draw when the machines are on and when they're off. We also saved a lot of money by appropriate waste streams for our giving sets. So if we put just the sharps tip into the sharps bin and put the rest into the appropriate waste stream, we save a huge amount of money as well as carbon through the appropriate waste stream disposal. So there's quite a few easy areas that we can actually identify Data storage is another big area. CT is probably our biggest data storage across globally. And what we found was that probably 70% of the CT data storage that we were storing was actually non-essential, because they were coronal or sagittal reformats that we could very well do just as well on the PACS workstation, and we didn't need to store those reformats, you know, for 30, 40, 50 years on servers, which actually cost the institution money as well for the data store, as well as carbon and water in the server environment.
And yet here comes AI, which is going to have a massive impact on the carbon footprint, especially of healthcare, especially radiology. What do we do about that?
I think with AI it's a tricky one. It's basically a balancing act, because training an AI model, and particularly training a foundation model or an LLM, is very heavy in terms of energy draw and energy usage. And we can see this with the big companies investing not only in large server spaces, but also investing in new ways to have green energy, such as local nuclear power plants to serve the servers. So we know that AI is having this huge impact. That's in the model development. But in the model inference, there's a lot of savings that can also be made. For example, faster sequences on MRI, reduction in artifacts and movement artifacts, etc., which will stop us having to repeat sequences, etc. A lot of AI in patient scheduling. If we can stop patients having to come back for repeat investigations, but maybe bundle things together. That's only one trip to the hospital, for example. So I think we have to look at it in the round with the life cycle assessment of the whole process. The other area I think I'm really passionate about is making sure that if we are going to train a model, that it's for a good purpose. We're not just doing it for fun, that we think, okay, let's think about what we want to train, what gap are we trying to solve, what is the problem, what do we need to train the model appropriately, and then go ahead and train the model. And then we're using that energy for a purpose, hopefully to be making savings down the line.
And do you have anything in mind when you say that?
Yes, one thing that I would like to do is to see whether we can train a model to actually clean the old data storage of all of the items that we didn't need to store, such as the coronal and sagittal reformats that are taking up about 70% of the CT storage and that will be stored over decades. I'd like to see whether we can work on an AI model that would be able to strip out non-essential data from our long-term data storage. I'm not sure if I'll get there, but let's see if we can.
Well, that is a good thing to aim for. Thank you so much, Andrea.
Thank you.